Okay, that's it. Okay, you good?
Enter your participant ID followed by pound. Otherwise, just press pound to continue. You have joined the meeting as an attendee and will be muted throughout the meeting.
Okay, now we're good. Okay, we're gonna go right back in and just act like we just started from the beginning, Bob. But let me get on Facebook Live.
Okay.
All right.
Okay, we'll stand by. WRNA and Trust 106.9 FM. We're going to now rejoin Omar Neal live.
Well, welcome to the You Got the Power Show. I am your host, Omar Neal. Well, I think congratulations is in order. We have with me Dr. Vanessa Enoch, the Democratic nominee for the 8th Congressional District in Ohio. Let's give her a round of applause. I mean, wonderful. Hey, Dr. Enoch, how you doing?
I'm wonderful. How are you today, Mayor Neal?
Oh, I'm elated, and congratulations to you for winning the Democratic nomination for Congressional District, and of course, it's now on to November, huh?
Absolutely. This is, as you know, my second race for this seat, and this time we doubled the number of people voting for us and brought in at almost 80% of the vote this year. So in this primary, so we're really excited about that and looking forward to the November general election.
Wow. Well, we are so happy that you have made at least this milestone, and of course, we got to work to get you into Congress so that we can really address some very critical issues. The COVID-19 coronavirus has ravaged not only this country, but the world. We've never seen anything like this in our lifetimes. And so therefore, leadership is going to be required in order for us to be prepared to deal with the aftermath of COVID-19. How do you see this thing unfolding?
You know, Mayor Neal, I think that, as you said, leadership is going to be pivotal. I think what has happened up until this point is that people haven't had to really pay attention to what leadership looked like in Washington, D.C. And I think we're seeing now, really, we're seeing it raw. We're seeing the incompetence of those individuals who are in the White House, as well as the incompetence of some of the individuals who sit in congressional seats in the House and the Senate. And I think people come November will be ready for change. And if people aren't ready for change, then, you know, we need to check the pulse of this nation, because, you know, traditionally people have voted against their own interests. But at this point, where we're seeing sheer devastation as a result of the decisions that are being made in Washington, D.C., if something isn't done about it this time, and we allow it to go on for another 4 years, I just can't imagine what the landscape of this nation's going to look like at the end of that 4-year process.
You know, we have engaged in hyper-partisanship in this country for decades, or for years, for eons, right? And so therefore, people will, you know, retreat to their respective corners, even when it's against their own self-interest, as you've alluded to. We even see that now, where there are cities that are opening up, and people are now violating all type of protocol and all types of mandates to say, if you've not seen 14 days in decline, then you should not reopen. There are states that have not had 1 day in decline that are opening up. And so that kind of message is confusing people. So people are going out, becoming vulnerable again. We're going to see a resurgence in the number of cases that's going to overwhelm our medical industry. And so therefore, we're going to continue to get into this cycle because people are not patient enough and we don't have clear-eyed leadership at the top. Agree or disagree?
I absolutely agree. And unfortunately, what you're talking about is the defiance of medical advice. People are, and these are legislators, governors of states, as well as the president and his White House are going against medical advice that says, here's how these viruses behave. Here's how this particular virus is behaving. And the only way to stop it is for us to isolate from one another and to shelter in place until the virus has run its course. And so against that medical advice, one of the things that I've noticed has happened is they've now gone out, Fox News and the White House, to find doctors, quacks, if you will, who are willing to say that this virus isn't that serious. And then we have people all over the country dying with the coronavirus. I had a friend here in Cincinnati died at home. I know that he was minor. He had some minor illness and wasn't reporting the same symptoms that I've heard on television. And then I heard a medical professional in a Facebook post say that our symptoms as African Americans are not the same symptoms that other people are presenting with, but they're not telling us on television that our symptoms are different.
Right.
And so we don't know. We're getting sick, we're dying in big cities like New York. It's just ravaged cities, and there are people sitting in their households with corpses that have been there for 3, 4, and 5 days because there's not enough coroners, not enough employees at the coroner's office to pick those bodies up. You know, it's ravaged our cities, our big cities, and those mayors in those cities, cities such as Atlanta, who are making those decisions to put people back out on the streets without regard to that medical advice. And they're taking our lives into their hands, and all of our lives, even up here in Ohio.
Well, the Atlanta mayor is not doing that. So let's say that Atlanta mayor has been against it.
I'm
now,
sorry, not the mayor. I'm sorry, I meant governor.
Right.
I did mean the governor.
Let's be very careful.
Absolutely.
About that,
she has been a jewel, even coming out to say that you know, we've had a very good relationship, the governor and I, but I do not agree with this decision. So I tremendously respect her for her leadership. And yeah, the governor, I have tremendous concerns about what's going to happen in big cities like Atlanta when you have a governor who wants to put profit above people.
But you know, you have that in I think almost 17 states now have some level of you know, relaxing of the stay-at-home kind of self-quarantine method that we're doing. See, I don't think that people understand. Now, one of the things that I want to talk about, because you're going to be representing communities of color as well, although your district is predominantly Caucasian, but there are people of color in your district, and of course, nationally. We are suffering at disproportionate levels than anyone else and impacted by this virus at disproportionate levels. That means that there needs to be some special attention given to the African American community as to, one, what is the comorbidities that give rise to this? Secondly, are we getting the requisite testing to determine the magnitude of the problem? And what measures of safeguards, given resources we need, that incentivize us to stay in our homes so that we don't expose ourselves unnecessarily? I mean, those things we need to be addressing.
You know, Mayor Neal, you're absolutely right. And many times It is our people who are on the front lines at the grocery stores, in the factories where they're up close and personal, and they're not in a position to work from home. Those people look like us. We are not privileged in places of privilege as far as economically, even in terms of having the resources to be able to stay at home. A good number of small businesses that were impacted by this coronavirus have been African Americans, and the government is asking us to borrow our way out of this pandemic. And I am perfectly aware that it's not just African Americans who are business owners, but we represent a significant number of those small businesses that had to shut down. We don't own the big factories and that are getting the huge contracts, nor are we working for those corporations. Many of us are working in the medical profession where we're on the front lines, and our people are the ones that have to go into the rooms. So you're absolutely right. And when you think about our underlying health conditions or comorbidities, we are significantly impacted by just terrible health outcomes as a result of the economic conditions that African Americans in this country have endured. And this virus has simply brought to the forefront and exposed what has been there all along. This isn't new for us. We've had these underlying health conditions forever as we've endured disproportionate treatment in the economy, where laws and the legislation that has been passed has not favored us. And now it's all coming to the fore, and it's becoming prevalent that our lives are being lost in this coronavirus. And so it could also speak to why the current legislators don't care whether we open the city back up. It's
that was one thing that I wanted to talk about, Dr. Enoch, is the fact that, if I believe, and I want to say this, I don't want you to put anything in your mouth, that if any other group was this disproportionately impacted, there would be more residents to open up the economy. I think that people kind of do a cost-benefit analysis concerning lives, and when they don't see the lives of people that are favored being threatened at the same level as those people are disfavored, then they say, okay, the economy has a greater value. And that's how I see it, Dr. Enoch.
And Mayor Neal, I absolutely agree with you. Those vulnerable populations, I think it's important for people to understand, they don't just consist of African Americans. And so when those decisions are being made, although we are disproportionately impacted, there are also other vulnerable populations, such as the elderly. And elderly people have a greater propensity to succumb to this virus, as well as people with compromised immune systems and other ailments, health ailments. But this particular administration and governors across the country have decided that those lives don't matter. Even in terms of making decisions to send children back to school, President Trump said the other day that children do really well with this virus. Well, there are teachers and administrators and counselors who are teaching those children. And so those kids could be carriers coming into the school system. And then it is the teachers and those school staff, the cafeteria workers, the janitors, the principals, and other support staff who we should be worried about. However, again, these individuals who are in leadership look at those populations and say, they're not important. Some people are just expendable. And so we should all be concerned about that. African Americans and Americans alike, all of us should be concerned about opening this country back up.
You know, one of the things that it's important to note, and you hit on one part, but these same children are going back into the homes with grandmothers
Exactly.
and parents and
Yes.
aunties and
Yes.
uncles and
Yes.
other people that are at greater risk because of the comorbidities that we talked about earlier. And so this is a bad look
Oh,
for us. And we have to be very clear on that. When people are talking about, opening up for what? I mean, this is May. School is out of just about May, right? School is out anyway. So to talk about opening up schools now for whatever reason, or to even project what it's going to be like in the fall, one cannot make that determination right now because we don't know how this virus is going to surge and how it's going to play out. I do know this, that the more we open up society, the longer it's going to take for us to mitigate this virus, because we're going to expose each other. The people will contract this virus and they will spread it amongst their people, and it's going to continue to perpetuate. That's the problem, is that people are trying to do it too quickly. They have standards, and this is one of the things that I want to talk about. They have standards that have been established, Dr. Enoch, that says 14 days of decline before you consider gradually opening up your economy in your respective areas. That's not even being adhered to by Republican leadership, where a Republican president is saying that that's something that needs to happen.
Mayor Neal, the medical profession absolutely has had some recommendations based on knowledge of how viruses tend to behave, based on knowledge of a previous and past pandemic from 1918. They know, we saw the data. When Spanish flu hit, there was a second and third wave of that Spanish flu when the weather conditions became colder. And we've already seen the behavior of this particular virus, even in air-conditioned situations. So we know it has similar characteristics, and that this virus will likely behave in the very same way that the Spanish flu and some other viruses that they've already identified the characteristics of have behaved. So we know what to expect. But those things are being discarded by a community that is, again, putting politics and profits over people. And that's the thing that concerns me. I understand, trust me, as a business owner, my business has suffered greatly through this pandemic. I would love to get back to the business of making money just like the next person. I am struggling. Make no mistake about it. My bread and butter comes from me working just like everybody else, but I want to live. And so I think as a country, what we have to be concerned about is looking at ways that we can sustain the populace while this thing passes, as opposed to putting everybody back on the front lines and allowing us, those who are vulnerable in our population, to succumb to this virus. We do expect the numbers to surge weeks after people go back to work and they're back out doing the things that they were doing previously. And here in Ohio, the governor has backtracked on even the idea of using masks because of the pushback that he got from his constituents who want to go about life the way that they've always gone about life, and ignoring those that medical advice that we've been hearing.
You know, what's interesting, Dr. Enoch, is that people who have apprehension about going back to work, if their particular industry has been released or opened up to for them to go back to work, and they refuse to go back to work, I am afraid that their whatever unemployment benefits that they may have been entitled to will no longer be available to them, that their employers will have grounds for firing them and not retaining their employment once everything gets to some level of normalcy. And so people will be penalized because of the righteous and appropriate caution that they should have about returning to a place where you got such close density in proximity to people.
Let's be clear, Mayor Neal, there will be no normal again. We are looking at a new normal. I can tell you myself that I won't be shaking hands, although I'm running for office, you can hang it up. But I stopped shaking hands even before the administration acknowledged that there was even a pandemic. I watched the news and I realized that there was a pandemic, and I made a decision to not shake hands. And in fact, the first time it happened, the people I went into a meeting with laughed at me because I refused to shake hands. And that was before everybody else realized that it was important not to do it. And I walked into Senator Rob Portman's office. And when his staff also refused to shake hands, I looked around the room. It was at that meeting. I looked around the room and I said, okay, the senator's staff refuses to shake hands, and you guys are laughing at me. So everybody in the room, laughed again. But thereafter, everybody was practicing those behaviors. There will be no normal. We are looking at a new normal from an economic standpoint, from a social standpoint, and what that's going to look like is going to be very, very scary for our economy. Some of these big businesses that are making money hand over fist right now won't be able to do that anymore. Somebody was telling me that they were on a plane the other day and they had to travel, and that there was no social distancing on the plane. And I'm like, okay, well, what was your expectation? How do you social distance on an airplane? It's just not possible. But there has to be some adjustments made in the workplace, in the way that we travel, in the way that we communicate, in the places that we go, bowling alleys and restaurants. They're going to have to make adjustments. We have to figure out a way to do things safely. And the most safe thing that we could do right now is stay home. So for people who don't have to go out, I'm encouraging people to continue to stay home until the virus has an opportunity to run its course. But it's still going to be spreading rapidly over the next several weeks, while people are now trying to return back to some form of normalcy and disregarding the fact that we are in a new place at this point. We're not where we used to be.
Yeah, what's one of the interesting things is that you mentioned it, is that the large businesses will survive. Many of them, some of them will not. But the small businesses are the ones that I'm most concerned about.
Oh, yeah.
Because they don't have the reserves
Exactly.
that the large businesses have. And with the first release of the stimulus dollars, $350 billion, very few small Black businesses received any of those dollars. And the latter disbursement, which is $320 billion, we don't know how that's coming out. That just came a day or so ago, was released a day or so ago. So we don't know. The other thing is that many Black businesses don't have accountants and really strong relationships with financial institutions. So they are not positioned to take advantage of these dollars readily. And the dollars are gone before you wrap up to be able to apply. And that's one of the things that I'm very concerned about. And that's what Congress should do, is to make sure that there are dollars set aside for people who are disenfranchised and do not have the traditional structures for businesses.
Mayor Neal, we're finding out that not even those big businesses and not even our government is able to sustain itself over a long period of time. In fact, the president threw his hands up after about a month of it and said, we've done all we can do. We can't do anymore. We're putting it in the hands of the governors. And then businesses as well. After a couple of weeks of this, businesses were saying, we got to go back to work. We can't do this anymore. So not even them have the reserves. They tell us have at least 6 months reserves. But we now know that big businesses and even our government does not have 6 months worth of reserves. In Ohio, our unemployment system is almost insolvent. They don't have the resources to even cover all of the individuals that are unemployed right now, let alone those that the president gave, or at least mandated through legislation, through the stimulus, to provide unemployment for business owners and 1099 employees. They don't even have the resources to do that, nor do they have the systems to be able to do that. So no business owners have received a dime. So those of us like myself, small businesses, when I say we are struggling while some of these big businesses have been given government handouts. They've been given no bid contracts. So those are the things we're not paying attention to. They're not giving those big businesses loans. They're giving them contracts and they're giving them handouts. And that's the difference between us small fish and then the big fish, because their friends and family members are making decisions in Washington, D.C. to ensure that they continue to line their pockets.
It's interesting, my being a mayor of a city prior, I recognize that municipalities are really going to catch it. I mean, we really live by retail and the taxes that are associated with retail. When retail is diminished, it has a direct correlation with the amount of resources that we have to maintain government. So therefore, the first responders and other essential people are vulnerable. I mean, you can't maintain them if you can't maintain the salaries, right,
police,
of these
fire,
individuals. Police and fire and all of those people.
medical.
People don't understand there's a direct correlation between this. And I think that's something that we need to talk about. And to have Mitch McConnell say that that let them go bankrupt. I mean, to be that insensitive. They didn't say that when it came to the major corporations. They didn't say just let them go bankrupt, but they say you can let municipalities and governments go bankrupt.
Even the post office, let them go bankrupt.
I mean, that's just to make those kinds of statements. That's so insensitive and antithetical to the overall economy of this country. Because when the cities go out, this country goes out.
Right. And when the rubber meets the road, Mayor Neal, what's actually happening is those individuals who are in a position to make decisions, financial decisions, are making those decisions to provide those no bid contracts that are continuing to help their friends. They're not caring about those of us who are paying into that system. They're not struggling. They're not suffering because they're taking care of one another. When we begin to really look at the numbers after this thing is over, it's going to be interesting to see who benefited, who suffered, and what's actually really going on in our government. And you hear.
Do you think there's going to be congressional oversight, Dr. Enoch? Do you think that there's going to be congressional oversight? Do you actually believe that?
I think there will not be congressional oversight unless we flip the Congress. And at that point, the risk will be passed. If we're able to change who sits in those seats in Washington, D.C., we're going to see a different Congress. We're going to see a Congress that will care about the people, but people have to make those decisions. They have to vote, and they have to ensure that when they cast those ballots, that they know who they're voting for, and they know what those people have stood for in those offices. We should not see people like Warren Davidson, who I'm running against, in those seats anymore. This man voted against the stimulus relief package when Congress first passed it, when they first passed it. We can't afford to have people in those seats that only care about big business and making money, and that vote against the people every single time. They're voting against seniors. They're voting against vulnerable populations, the mentally ill, the sick. They're voting against your medical insurance and care. And they're voting against our kids' education. We have to make decisions to get them out. You can't ask the police to police themselves. It just doesn't work like that.
Mm-hmm. You know, what's interesting is that I'm concerned about voting as well. Everything that we're raising, all of the issues have some ramifications on the future of our country.
Yes,
One is the voting. The foundation of this country is our democracy, our ability, one man, one vote, woman, man, woman, one vote, right? That's the foundation of a democracy, is to have people engage in this process. And with the COVID-19 coronavirus pandemic, there are a lot of people who will be hesitant to go to the polls. So therefore, if there's no provisions for write-in ballots and other distant,
yeah, absentee. We went to a complete absentee system in this round of voting. In fact, the day before the election, the governor announced that we wouldn't be voting until June 2nd. And we had our election, our primary election yesterday, and it was absentee ballot only. But I'll tell you what, the Republicans made it so difficult for people to vote that not many people came out. The voter turnout was terrible. And if we're not careful, if we don't plan for it, we're going to see something similar happen in November. There have to be ways for people to vote safely from home, absentee, and we need to make voting easier anyway. There's no reason why once somebody turns 18 years old in this country and they're eligible to vote, that they're not automatically able to cast a ballot. They make voting so difficult by the gerrymandering, by doing everything they possibly can to make sure that your vote does not count. And so it's going to be pivotal in this election that we put systems in place before the general election to make sure that every vote counts, to make sure everyone has the opportunity to vote.
You know, what's interesting, yeah, we can talk about that, but each of these states are making independent provisions. There is no national effort to ensure that people have the right to vote, and that provisions are made for this distancing requirement. And so whenever people are not just going to just automatically just go back and start doing things. It's going to take time for people to have confidence that this virus has subsided to the point that people feel comfortable enough going out again, right? So that's really voter suppression, when you don't make provisions for people, when you know that danger lurks for them, even a matter of life and death. One of the things, Dr. Enoch, that I don't think people understand, this virus is lethal. Let me put it this way. You can literally go out one day, go into the wrong space, contract the virus, and in 21 days, they're making preparation for your funeral.
Oh, yes.
Or less.
Absolutely.
Right?
And Mayor, you said something that I don't want to get too far from. I want to just sit on something for just a second. this president, this administration has taken the idea of states' rights versus federal rights to a whole new level in this country. He has used our tax dollars for his own, as though they are his own personal dollars. He's writing checks and determining who he's going to write those checks to, which governors and which states he's going to give money to, based on which ones are nice to him or kisses his backside, for lack of a better way to say it. And that is a significant concern. These are our tax dollars that they're spending. This isn't his own personal funds. While he puts his face and name on the stimulus checks that come out, and don't miss the fact that those checks were not checks to help people through difficult and challenging times. Those were stimulus checks that were designed to stimulate the economy. Those are the same stimulus checks that other presidents before him sent out to people. Barack Obama sent out a stimulus check. George W. Bush sent out a stimulus check. So this isn't a unique or abnormal thing to do. However, we're in a very unique and abnormal situation. There is no provision, really. When you look at what's happening, there's been no provision. In fact, even while President Obama was in office, he provided a loan program where he attached it to mortgages to first-time home buyers in order to help stimulate the economy. Well, this loan program that President Trump has initiated is no different than that loan program. If you've got people borrowing money, it is, again, to stimulate the economy. It's not about trying to help people who are suffering and helping people who are in trouble. And the states don't have the resources at the magnitude that the federal government has resources. So we can't give our federal government a pass and say it's okay for the federal government to step away and say they're not going to provide whatever the states needs, whether it be ventilators or testing or what have you. And those are the arguments that are being had right now in the White House. So we have to pay attention to what's happening, because these decisions are impacting us, and many people have no clue about what's happening in those spaces, in those political spaces, those decisions that are being made about our lives.
You know, you're absolutely correct. One of the things that I was talking about as well, and you know, we're having these conversations about the economy and how to get this economy going. And I heard somebody say to me, these Trump checks are going to be coming out. So in the Black community, people who are unaware, not listening to Dr. Enoch or Omar Neal or others, are thinking because he has attached his name to it, they are now associating these checks with Trump checks, right?
Exactly.
Which means that many people who are ill-informed, right? Those individuals will give him credit for a check. One is Congress authorizes those stimulus package. He just signs off on them, right? It's Congress that authorized the disbursement of the Treasury, right? So
same as every other president before him, he's taking credit for it, but he's doing it on a whole new level by wanting to put his name and his face and whatever on those checks.
Yes. I mean, he literally, for the first time, I think any president in the history of the presidency, signed his name on a check.
Yes.
I mean,
it's very, very scary.
That's narcissistic. I mean, that's a whole nother level.
We've seen narcissism in government unlike we've ever seen it before. Those daily press conferences are hilarious, where each and every person who stands up to speak, they stroke Trump's ego and whatnot. And it's so funny to me. I wonder what the conversations look like before they ever come out and talk to the media. I mean, do they put them, they stand in a room and say, okay, here's what you got to do. You got to stroke the president's ego.
You don't have to tell people. Those things understood need not be explained, right? So, I mean, so that's how that is. Let's talk a little bit about this notion. How will this end? We talked about this whole notion of they say herd immunity, right? Where we have enough people who have either contracted the virus and have overcame, right? And they will then establish some kind of immunity to it, right? Antibodies that will protect them, right? And so therefore herd immunity allows for us to go through absent of a virus, absent of a vaccine, right? So what are we doing? Some people are saying, let it be the survival of the fittest, which means that let it go through the population because it will, and the people who will survive, and the people who won't. But don't destroy the economy in the process. Don't throw the baby out with the bathwater.
So, Mayor Nero, I have an affinity for research. I'm not a medical doctor. I'm a doctor of public policy and social change. However, I do have an affinity for research, and I've continually read the research. I'm, fascinated with this whole pandemic. So I've read the medical research to see what's being said. A lot of the research has come out of China and some of the European countries who were initially battling the coronavirus. And one of the things that those medical journals are saying is that they are not sure about whether we can contract this virus a second time and whether we build up an immunity to the virus. In fact, there was some people, I've seen several videos on Facebook and on different social media channels where people had the virus and they stayed at home and quarantined for 14 days and went back and retook the test and were told that they have to quarantine for 14 days because the people who tested them did not know that they had already served a quarantine for 14 days, but they told them you are contagious and that you have to stay away from people. So we don't know if those antibody tests, medical science, they don't yet know if we build up antibodies that protect us from contracting the virus again, which is a very scary thing because even getting any kind of a inoculation will depend partly on understanding the behavior of the virus and whether or not utilizing those antibodies from from individuals who have recovered, whether those are actually going to help us. I've heard doctors say and have read that this virus could behave much like HIV and AIDS, where once it's in your body, and you never recover from it, and it can continually resurge, which means that what has to happen is we have to be concentrating on finding a cure. And that is what's important here. It's that the medical community, the science community, corporations who have the wherewithal, that they all come together. And I have heard some of that coordination on the part of scientists, medical doctors, and the business community in coordinating efforts to try and come up with a cure for this virus. I think at the end of the day, that's what's going to have to happen. And unfortunately, we know that finding cures take time.
But it's years. That's what I was about to say. I mean, you may take 10 years. I mean, or longer.
Yeah, we still don't have we don't have a cure for AIDS, and we don't have a cure for cancer.
So cures are the other thing about vaccines. A couple of things. One is, if Black people are not in clinical trials, right? Then sometimes vaccines don't work for us because there is a different biological construct that you alluded to earlier, Dr. Enoch, that Black people respond to viruses differently than others. And if we're not a part of the clinical trials, then there can be a vaccine that does not help us. That's another thing. The other thing is that there is a distrust that we have, generally speaking, in the medical profession. Tuskegee syphilis study is one of the reasons why we have a legitimate cynicism and distrust in the medical industry. And so there are a lot of Black people who will not take the virus the vaccine, once it has been developed. The other thing, I'm concerned that we're rushing this too quickly, that we're going to come out with something that is going to be more damaging because of the hastiness, and we've not gone through the proper trials and to get the proper results over a period of time, that we can say that this that there's fidelity in this trial. I'm concerned that there may be something that's placed out there universally that may have a damning effect to the general populace. I'm concerned about that. And then the last thing I'm concerned about is that if there is a vaccine, then the rich and the powerful and the well-connected will be the ones who get it. And the people who do not have money or resources or value as a society attach value to you, that you won't get it. And I'm concerned about that.
Absolutely. And it's not a new thing that the medical community has ignored the differences in African Americans when it comes to our responses to certain things. Even for something as simple as a thyroid condition, our numbers tend to be different. There aren't enough medical professionals of minority descent, which we know that when you have minorities, African Americans, and other people in the medical profession, that they tend to focus on conditions that concern us. And there's not enough of us in the medical community because we've been shut out of medicine and out of some of those places, science and medicine and mathematics. We've not had the opportunity because at a very young age, we are not trained properly. I heard a radio talk show where they talked about if children are not able to read at the end of the second grade, that in some cities, they're not allowed to continue teaching those kids to read. Those kids are lost. And those are the kids that they set up for the prison population.
Right.
So we've got to be concerned specifically for the African American communities of color going forward when these tests are being done, because our symptoms are already being identified as different. A lady in the medical community said that the symptoms for African Americans tend to be things like malaise. They're coming in, they're just feeling like something's wrong and can't quite identify what it is. They just don't feel good. Leg pain and things like that. And those are not symptoms that we're hearing in the mass media, but people, African American people, in fact, in the medical community is saying, people, listen, take this serious. Here's what's happening to us. This is different from the symptoms that's happening to everybody else. And so that we've got to urge the medical community. And these things happen through legislation, through ensuring that there is funding for research for specifically African Americans, and to make sure that the medical community takes into consideration our unique needs for African Americans.
You know, we got just about 4 minutes left, and I want to hit on a couple of things. One is funding. You mentioned that, and there needs to be an unequivocal direction of funding directly to the African American community as it relates to this pandemic, because we are disproportionately impacted by it. And so therefore Congress should make allocations to the African American community, specifically for testing, for making sure that we have the requisite funding, that we can stay in home and quarantine ourselves and not force ourselves into survival mode to go out to try to do that. The other thing is too, and we've not talked about the food shortage that's happening, where people are literally in food deserts, and they are more disproportionately impacted by the shortage of food than other people. But everybody will find themselves in some quandary as it relates to the shortage of food. That's one thing. The other, and the last thing that I'll talk about as we get ready to leave, and that has to do with what will we do for our first responders. We have all kinds of PPEs for the medical industry and all of that, but your firemen and your police officers and your other people, you know, they don't have the protection that other people have, and they're going home to their families as well. And I think there needs to be a concentration on your first responders in making sure that they get not only mental health, but also protection as they do their work, because they're of their essential nature of their work. Just a few minutes. We got 2 minutes, and so take a couple of minutes. Not a minute. Just respond to that, Dr. Enoch.
You know, Mayor Neal, I'm so glad you mentioned first responders. As someone who has developed trauma centers in the community, our first responders need to be our priority. Not just looking at police and firemen, but they are seeing the death up close and personal, as well as people in the medical community. I don't know if you saw the story about the female doctor who contracted coronavirus and then committed suicide just a few days ago. This virus is taking a significant toll on that community, as well as our police and firemen and others who are on the front lines. And no, they don't all have PPE. Not even the medical community has proper PPE right now. That is a lie that's being told on a federal level. I know, because I am on the board of organizations that are sewing masks by hand. We've got women and people who are sewing masks and ensuring that the medical community gets proper PPE. They don't have it. They're not equipped. In hospitals even, I've got friends who are saying they are afraid for the first time in their lives. Entire police departments are becoming ill with coronavirus. And so we've got to take care of all of our first responders, our grocery store workers, our teachers, as I mentioned before. We have to be concerned with anybody who has to be out there. Meat packing plants, hundreds of people in meat packing plants are getting sick and dying of coronavirus. So we've got to take care of all of our vulnerable populations.
We got what I see is we have to have a national response to this, because states, depending on what party you're in and how the state leadership looks, they're doing things that oftentimes that are antithetical to the best interests of the general populace. And so I think that's very important. Now, let me say this: time is out. Can you imagine we had an hour? We've been talking with Dr. Vanessa Enoch. Dr. Enoch has just won the Democratic nomination for the 8th Congressional District of Ohio. We're so proud of Dr. Enoch. She's been a regular. She's been on the You Got the Power show many times, and so those of you who've been followed our program, you are not unfamiliar with Dr. Enoch, but she's a special person, someone I love with a perfect love. I'm so appreciative and so happy that Dr. Enoch was able to join us the day after you won. This is just the first, maybe the first interview after you won. I don't know, but even if it isn't, I'm so glad to have you so close. Don't forget tomorrow, that's going to be Thursday, April the 30th, we'll be doing a live webinar The Color of COVID-19 in Maryland, Confronting Racial and Ethnic Health Disparities During a Global Pandemic. That's in conjunction with the leadership in Maryland and the University of Maryland Department of Public Health. And so I'll be moderating that webinar discussion. That's going to be tomorrow at 7:30 p.m. Eastern Standard Time, 6:30 Central Standard Time, and of course 4:30 Pacific Standard Time. And so, guys, that's going to be it for us on this segment of You Got the Power. As always, I'd like to leave you with these two words. Don't forget to support the program before we tell you that. Don't forget to support the program by sending your checks and money orders in care of You Got the Power at P.O. Box 146, Tuskegee, Alabama 36087. Or you can also support us by PayPal and Cash App on our Facebook page. As always, I'd like to leave you with these two words. Remember that I love you with the perfect love. But more importantly, remember this. You got the power. We'll see you next week, same time, same station. Have a wonderful day. Bye-bye, Dr. Enoch.
Bye-bye. Take care.
Yeah.